Good afternoon, and thanks for joining us. And I'm sure the eagle-eyed amongst you will realise that I am not Deputy Fairbrash, who, as chair of the CCA, you'd normally expect to see at these briefings. Well, the reason for that is he hasn't been feeling very well, and so yesterday he attended PNR and CCA meetings remotely from home before having a PCR test, and that test has come back positive this morning. So he'll now be isolating from home, and I'm sure you'll all join me and everyone on the platform here in wishing him a speedy recovery. Now, ordinarily, I am just an advisor to the CCA, but as Vice President of Policy and Resources, I'm required to stand in for the chair on the CCA when he's not available, and for whatever reason it might be. As such, it falls to me to update you on the authority's most recent decisions. Before I do so, I should point out that my fellow panel members, Drs Brink and Raby, and I wore masks coming into the theatre here, and as we're in a large, well-ventilated room and spread out, we've taken them off for the briefing, in keeping with recommendations. We've also just received negative results from lateral flow test 2 and have no symptoms. So here we are. And you'll all know that yesterday the CCA considered whether the use of face coverings should be mandatory. And you've probably all already heard the decision was not to go down that road, but to continue to strongly recommend them in certain settings. So what are those settings? Well, where physical distancing isn't possible, where there's poor ventilation, and where there are close crowds, where individuals need to work in very close proximity with colleagues or customers. Some of you will think that's the right decision, some won't. But let me reflect a little bit on the debate CCA had and how that decision was reached. Firstly, none of those on the CCA found it an easy or straightforward decision. The open letter from Deputy Fairbrash last week outlined the very compelling arguments, both for and against, making the use of face coverings compulsory. And since that open letter was published on Friday, cases have continued to rise. For some of you, that will seem like reason enough to mandate face coverings, maybe even go further still. After all, if we were looking at these sorts of figures 6 months ago, I'd have agreed. And I've no doubt the CCA would be using its emergency powers to impose very significant restrictions. But we're not. Whilst it's not an easy decision, the fact that CCA isn't imposing restrictions now shows how very different our situation is. As a community, has one of the highest vaccination levels in the world. Dr. Brink will take us through the vaccine figures later, but as a little taster, I can say that an amazing 92% of all adults have had 2 doses, and the booster programme is making a really good progress. All that in less than a year. Dr. Raby will describe the situation at the hospital, but it's very clear that because of our high vaccination rates, the hospital is in a good position. So while the number of active COVID cases rise, and on the face of it that can be unsettling, it is not reflected in the numbers who are seriously ill and needing hospital care. So as always, and as we've tried to be since March last year, we need to be proportionate, we need to strike a balance. But what really made a difference for the CCA in its decision yesterday was you. In the past few days, I know we've laboured the point about face coverings and how important it is we do use them to limit the spread of the virus as much as we practically can. I get the frustration after 20 months of this, we'd like it to all go away. But you, our community, our islanders, have responded tremendously to what we ask you to do. In the last few days, we've seen the use of face coverings increase dramatically. Retailers tell us that they're now seeing around 80% of customers using them. And yes, we know that's not the case everywhere, but certainly you can see there's been a gear shift when we're out and about. And let's remember what we're trying to do. Well, what we're not trying to do is stop every single case of COVID. We really don't need to, given how well vaccinated we are. Remember, our hospital is coping well. What we're trying to do is reduce the spread, slow it down, keep cases manageable. Right now, even with our very high numbers, they are. Our day-to-day life is hardly affected at all. We just need to take some precautions in settings where the virus is most transmissible. Now, while we want to keep our hospital in a good place, and that's a big priority, we're also trying to make sure other services, both public and private, and businesses and jobs generally, are not put under too much pressure. COVID is a mild illness for the vast majority, but if you're a positive case, it does mean 10 days isolation. For some, that's no big deal, and you might even work from home if you can and you feel okay. But for some, it means they can't work. So we need to watch carefully how the rising cases are impacting those staff, particularly in critical services. So there are considerations outside of purely the numbers in hospital. As ever, as the three of us know only too well, having been on this from the start, managing COVID is far from straightforward. When it comes to wearing your masks, we know there are times it's far from practical, when you're out for a meal, for example. We know sometimes it feels a little bit silly to wear it, say in a meeting room when you're just taking it off back at your desk, or to wear it on the bus but taking it off in the pub. But this isn't about trying to police some rigid set of rules. This isn't about some perfect art of mask wearing. This is about COVID spreading from one person to another fewer times in a day than it currently does. If you wear that mask sometimes, but not all the time, it does not undermine the whole thing. It really doesn't. You've still prevented potential transmissions some of the time. Preventing some transmissions is a good thing. So let's not beat each other up about who's wearing a mask the right way or the wrong way. No one is perfect. But every effort we each make contributes to an overall improvement in transmission rates. So let's try to encourage each other, not give each other a hard time. To those who, for whatever reason, are just plain anti-mask, I'd also appeal to them. Masks haven't been made mandatory and no one wants to force you to do anything. But we do want to work with you and for you to work with all of us. We're not asking you to overhaul your lifestyle, but we are asking you to do a few small things to limit the spread. Take your lateral flow test, wear a face covering where recommended. It does make a difference. We're trying to strike a balance, not be heavy-handed, but also not complacent. It's a fine line to tread, but we can do it. It doesn't have to be all or nothing. This is about living responsibly with COVID, and I emphasise the responsibly. The fabulous Gary Burgess put it as well as anyone could in an article he wrote last week. Living responsibly with COVID doesn't mean pretending it doesn't exist. As ever, the CCA will keep its current guidance under review. If things change dramatically in the coming weeks, it will reconsider its approach. But I believe we can manage this if we do a good job of following the recommendations. It doesn't have to be a perfect job, but a good job. If we can do that and keep the balance right, we can get through these winter months, enjoy our Christmas celebrations without any major disruption. Now, as I've stressed the stable situation at the hospital and how that was a key factor in the latest CCA decision, we thought it made sense to invite Dr. Raby back so he can give you his expert update on how things are. So I'll hand over to Dr. Raby next.
Thank you. The hospitals, we're really grateful for the huge amount of public interest in how the hospitals managing during this time, and thanks for that concern. The update today is we have 4 patients in the hospital with COVID. We've got 1 other patient who's had COVID and has been declared recovered, but we know that people can continue to test positive with a very sensitive PCR test for some time afterwards, and so we're treating that patient in isolation as well. Of the 4 patients who are in with active COVID, 3 of them would have been in hospital anyway. They're not in because of COVID, and they're not receiving treatment for COVID. They're in for other things. We have 1 patient who's in and receiving treatment for COVID. Of the 4 patients, the one who's receiving treatment and 1 of the others are unvaccinated, and that's something that we have noticed is that the patients who are requiring the most treatment for COVID are coming from the unvaccinated population. So that's the position today. Now, we keep a really close eye on what's coming down the pipeline into the hospital as well. So it's not just what's in the hospital today that matters. For example, we're expecting possibly 3 of those patients to go home tomorrow. It's what's coming in next. So we meet regularly with primary care and with the emergency department and with others to say, what are you seeing out there? Because in previous waves, they've been able to tell us we're seeing a lot of sick people. We think some of them are going to need hospitalisation. And the position last week and the position again this morning is that primary care are seeing a lot of respiratory illness out there, but they're not seeing a lot of sick patients, and certainly not sick patients with COVID who they expect to need hospitalising. So we're not seeing a train coming down the tracks with lots of COVID patients on it towards the hospital at the moment. Another thing we look at really carefully is what's the profile of people on the island with COVID, and Dr. Brink's team produce this information for us daily. So we know that people on the island with COVID today, a large number of the unvaccinated ones are in the very young population. So they're protected to some degree by their age from hospitalisation. We know that COVID in young people tends to be a mild disease. Most and the great majority of the older patients with COVID today are vaccinated, double vaccinated, and many of them will have had boosters. So they'll be protected by virtue of the vaccination. So looking at what's coming down the pipeline, what primary care and the emergency department are seeing, what the profile of the patients with COVID is today, and the current position in the hospital, we're confident with the place we're in at the moment. The background, of course, is that we have a lot of patients in the hospital who we would have liked to have in care homes and nursing homes, that sort of thing, and that remains the case. We've got 26 in the PH today who ideally would be in another setting, and that does affect the way our staff work. And it's, you know, I just want to take the opportunity to say thank you to those staff who are looking after them. We've cohorted 20 plus patients up on Gifford ward for that. Now that's not what those nurses signed up for, and it's really fantastic the job they're doing up there, and I just want to say thank you to them. But in terms of COVID, message very clearly, we're comfortable with what we're seeing and what's coming down the tracks, and as soon as we're not, we're going to shout. Thank you.
Thank you, Dr. Raby. And I know personally the great thing that's done in managing the hospital on a day-to-day basis, and sometimes it can be harder than others, but I think hopefully that's given people a lot of assurance of what Dr. Raby has just said. I'll now just hand over to Dr. Brink.
Thank you so much, Deputy Salisbury, and thank you, Dr. Raby. And of course, it wouldn't be a media briefing without the slides, and I think you know how much I love my slides. But I think what I wanted to highlight today was the central role of our vaccination programme. Our vaccination programme is something that islanders can rightly be proud of. People have engaged with us, they've engaged with the vaccination centre, and we have vaccine levels that are amongst the best in the world, and I think that's incredibly encouraging for us. And what we do on a twice-weekly basis, we will look at our vaccination uptakes. So these figures are actually from the 15th, so they're a few days old. But what you can see here, our whole population, of our whole population, that's every single islander, 81% have had at least one dose of vaccine, and that's an incredibly high level. If you look at the over 18s, 92% are double vaccinated of over 18s living on the island, with 94% having at least one vaccine. If you then look at the over 50s, the numbers are even higher. 97% are double vaccinated and 98% have had at least one vaccine. And monitoring the progress of the booster program, 40% of people have now received their booster. So really encouraging progress on that. Again, younger people have been fantastic in their engagement with this program. And if we look at our 16 to 70-year-olds, 80% have had at least one dose of vaccine. And going down to our 12 to 15-year-olds, just under 50% have had their one dose of vaccine. Now, again, with the younger population, we've chosen to vaccinate this group within the Community Vaccination Centre. We were very clear that we wanted to offer a bespoke program to this group of individuals, just as we offered a bespoke program to our pregnant women as well. And this enables people to go to the vaccination centre, have a discussion. They're not rushed, there's no peer pressure, and we will always keep our evergreen offer for vaccination. So people who have initially declined vaccination are welcome to attend for vaccination when they feel ready to do so. And we feel very strongly that that's an offer we should keep open for islanders. I think you're aware of the recent JCVI recommendations. That's the second dose for 16 and 17-year-olds, and the boosting to go down to 40 to 49-year-olds. We follow JCVI recommendations, and the Committee for Health and Social Care are currently considering this. So a very, very favourable position when we look at our vaccination programme. But what we've always said is vaccination is central to our pandemic response at this stage. So the most important part of our pandemic response remains our vaccination programme. But as we enter the winter months and as we have community circulation of the virus that causes COVID-19, all of those additional measures that we can do are additive. So they'll be synergistic and help us keep COVID levels under control. So this stay at home if you're unwell. Face coverings, Deputy Salisbury spoken in detail about face coverings, and I'll provide some more information of that in a moment. But our testing program, so the surveillance testing, we've had a fantastic response to the lateral flow testing. Islanders have been picking up their lateral flow test. They are undergoing their surveillance twice a week. We are picking up positive cases this way. So again, we owe a huge debt of gratitude to islanders for engaging with this program. We are so fortunate to live in this community. So then the other parts of lateral flow testing are think about how you use it as well. So if, for example, you're attending a large event, there are going to be lots of large events coming up, is do a lateral flow before you attend that large event. You're protecting your community. We're working together that way. Also, if you have a vulnerable relative that you're going to visit, think of doing a lateral flow before you visit that person. So again, we're using our testing in a smart way to protect our community. Symptomatic testing remains through PCR. The lateral flow testing is great for surveillance testing, but if people have symptoms, we'd like them to phone and book a PCR. And again, good engagement with that. Our contact tracing program remains in process, and our contact tracers, as you can imagine, have been working incredibly hard over the last week. And these are people that have fallen back into 7-day weeks, working late into the evenings, and they've done so without complaint. And they're there to help the community. Now, however, as the numbers rise, contact tracing becomes one of a suite of protections that we have. And so it's really following the World Health Organization do-it-all approach. So we've got the stay-at-home, your face coverings, all of the suite of testing, your contact tracing, ventilation, particularly important with the Delta variant of concern. What we are seeing, our own experience on the islands is that if a person becomes infected within the household, we're seeing quite a lot of secondary transmission within that household relating to close contact, ventilation, and so on. So being in a well-ventilated room is important. We've got the doors open here. Meet outdoors where you can. And we know that being in a closed, poorly ventilated room means that those viral particles will hang around in the air for longer. So things like wash your hands regularly, really important, physical distancing as well, so respecting personal space. So what we want to promote as we enter the winter months is that do-it-all approach. We can enjoy Christmas. We can keep this virus under control, but what we need to do is engage with all of those measures. Every single one of those measures is not going to stop the transmission of the virus, but they're going to work synergistically to just contain the transmission of the virus to measures that we can protect our hospital and protect our healthcare infrastructure. And that has always been something that has been critical in our modelling. So I wanted to spend a little bit more time talking about face coverings today, because that has been something that has been the subject of a lot of debate over the last week or so. And the science of it is simple. When someone speaks, coughs, sneezes, what they do is they release larger droplets, but also tiny droplets known as aerosols into the air surrounding them. And these can contain COVID-19. And these then particles can then be breathed in by someone else. So the logic is that covering the mouth, the nose will reduce the transmission of those aerosols. And we know that it can reduce, if a person wears a mask, you can reduce the transmission of if you're ill, you can reduce the transmission of the virus by about 80%. And if we look then, what model we're looking at. Now, most effective is if the person who has got COVID, together with everyone else, wears a mask. So again, that's that synergistic complementary relationship where the person from whom virus is coming from wears a mask to reduce the amount of virus expelled by about 50%, but the person who's not infected, they can reduce the amount of virus expelled by about 80%. The person wearing a mask can then reduce the amount of virus they inhale by about 50%. So you're looking at that. So the most effective is both people wearing masks. The second most effective is if the person who has COVID wears a mask and the other person doesn't. Now, the problem with that is a lot of the symptoms, particularly in double vaccinated people, can be very, very mild, atypical, bit of headache, bit of fatigue. So it can be difficult to say whether a person is infected. Also, people will be very infectious just before they develop symptoms. So relying on that is not something we'd endorse. And then the least effective person is when you have a person who's sick, expelling virus into the atmosphere, with a person who's well, not wearing a mask. So what we want to endorse is this model where we all wear a mask, because some people will be out and about and inadvertently be infected. They won't know about it, and they will protect their community by wearing a mask, and that person will protect themselves from inhaling those infected viral particles. And what we need here is good community participation. Together, if we all do this, it provides an important component of the World Health Organization do-it-all approach to reduce the transmission of the virus. Now, there's always a lot said about the active cases by vaccination status. And if we look at the active cases by vaccination status, what you can see is most of the cases we're seeing are in the 10 to 14 age group. And obviously, that and the younger group are the group that have had the least vaccination. What you see here is good levels of vaccination in people with COVID from about 27 years and above, or 20 years and above. But I think you've got to interpret this data with caution. So what we know, if we look at our total amount of COVID cases, is about 58% of our cases come from 81% of our population. 42% of our cases come from 19% of the population. And the 19% of the population are the ones that are unvaccinated. So when you're looking at the burden of COVID on society, we know that from the 82% of vaccinated population, we're seeing 52% of our cases. In contrast to that, if you look at the unvaccinated population who have COVID, that constitutes 18%, and they're constituting just under 50% of cases. So that gives some idea of what the vaccinations, how important the vaccination status is. And so finally, just to update you on our number of active cases that we have today an increase of cases. We have 482 active cases, and we've fortunately had no further deaths, with the majority of those cases having been recovered. And again, that is testament to the efficacy of the vaccination programme. So I'm going to stop there, Deputy Salisbury. Thank you very much, and I'll hand back to you.
Thank you, Dr. Brink, and as informative as ever. So we'll take media questions in a moment, but I'd just like to take a moment to mention the Guernsey VaccinAid appeal. The Overseas Aid and Development Commission, together with UNICEF UK, is appealing to raise funds for vaccines for people in low and middle income countries. Just remember that by helping to vaccinate the world, we'll help to bring a faster end to this pandemic for all of us. And you can find the page to donate by searching VaccinAid, so that's VACCINAID, Guernsey. And Islanders have raised a tremendous £36,000 already. And I know all of us here on the panel would endorse that campaign. So thank you very much. So now over to questions.
panel. It's Juliet from the Guernsey Press. I was just keen to ask a question about young people and masks. We're obviously seeing a very high number of cases in children aged 14 and under, who are obviously spending a large proportion of their days in classrooms with lots of other children and their teacher. What sort of considerations did you have about not advising students to wear masks in classrooms? And do you think that's something you might consider in the future?
I'll hand that over to Dr. Brink, because I know a lot of work has gone on with Dr. Brink and her team, with the schools, with her teachers and officers at Education, Sport and Culture. And we had a very long briefing from by email, but from Deputy Murray just the other day about it. I think, Dr. Brink.
Thank you for that. And I think that's a really great question. And I think, as ever, it's looking at the proportionality of the response and the ability for children to carry on with their programme of education. So if you look at the mitigations that are put in schools, they're focused on where you have large numbers of different students mixing from different years. So in corridor areas, in communal areas. So mask wearing has been focused in secondary school on that age group. Now, of course, we keep everything under review, but I think we've got to balance the proportionality here, the need for the children to be educated, to be able to be in a classroom, and there are other mitigations in place in the classroom. For example, there's been a big push on ventilation, on making sure the classrooms are well ventilated. So mask wearing, as ever, is one of a suite of mitigations. Now, in addition to mask wearing in the communal areas, ventilating the rooms, we've also got the lateral flow testing programme in schools, both for the twice-weekly surveillance for secondary school students, but also for the daily testing for contacts of cases. And we're managing to keep a lot of children in school through that process. So, to answer your question, yes, we will keep it under review, but it's important to consider mask wearing alongside the other mitigations and, as always, the proportionality of that response.
Thank you.
Question for Dr. Brink. It's Ewan Duncan from BBC Guernsey. Is there any advice on wearing of masks with, for example, choirs, singing groups, or maybe contact sports? You know, at this time of year, people will move from outside to indoors. And I guess also things like nativity plays that are coming up, school plays, etc.
So I think, again, we've got to think of our suite of recommendations. So to wear a mask, I mean, I would find it difficult to do this briefing in a mask. To wear a mask, if you're singing in a choir, well, you can't sing in a choir. So you've got to think of what other mitigations you can have in place. So, for example, if you have a choir, I'd recommend that you do a lateral flow test before you go to your choir practice. Again, with nativities, the schools will do their own risk assessment, but do a lateral flow, have your choir in a well-ventilated room. Whilst you're coming in, wear a mask. When you're going out, wear a mask. So I think with all of these things, it's not going to be a one-size-fits-all, because you're not always going to be able to wear a mask. What we're saying is wear a mask where you can, in a crowded, poorly ventilated space. But for a contact sport, you can't put a mask on people to play a contact sport. So in that case, we'd advise everyone to do a lateral flow test. And again, when they're off the pitch or off the field or whatever, is wear a mask then. So it's that do-it-all approach, but picking out the things that you can practically do for a specific set of circumstances. And I think this is where islanders have been so good, in that they're able to look at a situation. So many of the people I've spoken to have been really clear, and some of them have just honestly wanted validation of their approach. They'd done it all, and they just phoned me to say, well, I've done all of this, is there anything else? So they just wanted confidence to say, well, actually, no, I think you've done everything. Does that answer your question?
Yeah.
It's about that saying, don't do anything because you can't do that, is it, Dr. Brink? It's about, well, you might not be able to wear masks, but you can take a lateral flow test. It's about trying to live, again, responsibly with COVID and not trying to think back in the time when we were saying, well, you can't do this, you can't do that. It's trying to get back to some kind of normal.
I suppose it's that difference of 12 months on of the position we're in now, whereas maybe perhaps people are thinking back to last year. So I suppose there's that worry that the springtime, earlier this year, we went into a lockdown, but from what you're saying today, you sort of think we're in a much different position on mask wearing and contact sports and singing.
So the difference is we have a highly vaccinated population now, and that fundamentally changes our risk mitigation. Just to remind ourselves of that March of 2020, 17 islanders lost their lives in that wave of infection. And what we've seen with the subsequent, despite dealing with the more transmissible Delta variant of concern, we have not seen that impact on the hospital, nor have we seen the impact on mortality, on death. So I think that's of fundamental importance. We're in a different situation now with our highly vaccinated population.
And this is what we try to get to. This is what we aim to get to. The whole, when we wrote the document about moving out of lockdown, what the end would be, it would be vaccination programs. And we wrote it then and thought, oh, we'd never know when that would be. But we're there now, and it's now about saying this is looking and living under a new normal.
So you spoke about the importance of vaccination there. In terms of the booster jabs, this week it's been announced that they'll be extended to those aged 40 and above rather than 50 and above. When can people expect to be invited for their first vaccinations in that age group?
So it depends on the timing when they had their last dose of vaccination. I would anticipate, and again, I would need to have a look at the exact timings, that it would be by the end of January, but I'd have to confirm those timings. So it's 6 months after the primary course of vaccination.
Follow-up question. The English sort of medical officers advising the government there said that they hope to roll out the booster programme to younger age groups, younger than 40 and above, at some point in the near future. Is that something that Guernsey will consider as well?
So when the data becomes available, we'll always consider the data as it emerges, but we haven't specifically considered that data set at this time. But once it becomes available, of course, we will consider it.
Matthew Leach, Bailiwick Express. How long do you expect masks and lateral flow tests to remain a feature of our lives, given that COVID cases could spike again? Are they here to stay? Could they return next winter?
Well, I'll probably refer to Dr. Spring at the moment, but I'm certainly nothing is going to change before Christmas. I think that's we need to see over the hump of this the celebratory period and the time when we're expecting to have more respiratory diseases coming on and flu. It's all about seeing what will happen in the hospital over that period of time. So it certainly won't be before Christmas, and it's just saying, well, we just have to see how things go. Dr. Brink, if you want to add any more?
Absolutely. So we'll review it very carefully on regular basis, and we'll look at any emerging and new evidence. In the post-COVID world, do I think things will go back to completely where we are? No, because I think we're going to have a heightened awareness of how pandemics emerge and how we can prevent getting ourselves into such a situation again. So I think there's going to be a focus globally on pandemic management and pandemic prevention. And that'll include things like zoonotic transmission, so transmission of viruses and other infectious agents from animals and so on. So I think there's going to be a big focus on that. But I think we'll work towards Christmas and past Christmas, and we'll see what evolves over the winter period. We'll see about the emergence of any additional variants of concern, so we'll monitor all of that. But it is our intention to move back from any restrictions as quickly as we feel that we safely can.
Yeah, this is what we're saying is strongly recommended. It might become now it's eased off, we've got less concern going out of winter, wear them if you want to. And I think some people probably will still wear them if they want to, and that's fine. That's great, and I think it's got to be where people will ultimately feel comfortable. But at the moment, definitely strongly recommended, and not just for COVID, is it, Dr. Bring? It can for the flu that's around as well. It stops all diseases moving around, which is helps to prevent them spreading around anyway.
Yeah. No, absolutely.
Sure.
Kate from ITV News. Just following on from Juliet's question, really. We know a lot of more children are testing positive for COVID and having to isolate. What's your advice to families, particularly with younger children, about having contact with those youngsters? Because that's going to be difficult, isn't it, for a lot of them?
Yeah, you've 100% got to be practical under these circumstances. You cannot put a 4-year-old in a room and ask him to isolate for 10 days. It's just not going to happen. So what we do is we try and explore the situation with each household, and there are things sometimes dad can look after one set of children, mum can look after the others. Sometimes it's just not practical, and we have to say, well, we accept that there's a risk, and then give people risk mitigations that they can use. Things like young children, we also say they can go out into, if they've got a garden or balcony, they can go out into that space. It's important that we look after their general physical and mental well-being again as well. So we go through all of that. And I have to say the support we've had from parents has been absolutely phenomenal. And from parents with young children, they've been really imaginative in what they do. Although one parent did say to me that her child managed to get all of her Christmas presents out of her mother early. So we might have some behaviour like that.
I do appreciate it. It's hard for people, for parents. Juliet.
I'm hoping you possibly allow me a two-pronged question here. Obviously, Guernsey people have really adopted the LFT tests, but I'm sure you've probably heard the same way I have. People who've got a cold are going, oh, but I've had an LFT and it's negative, and are possibly choosing not to get PCRs. Does that concern you?
Yes. So it's really important that if you do have cold-like symptoms, the gold standard for diagnosing COVID is PCR. You can use lateral flows are great for surveillance testing, but as I showed on my wheel that I'm using at the moment, is we need to use PCR to diagnose infections.
And the second part of my question was, apparently on average we all catch between 2 and 3 colds per winter apparently. Do you think it's practical for people to get 2 or 3 realistically PCR tests this winter and the time that involves? Do you expect people to actually comply with that? Or do you hope they will?
I would ask them to. I understand how difficult it is, and even if we get, the more compliance we get, the more successful we'll get at just keeping it under control for the winter. But I'm a realist. I know that it is extremely difficult, and I know it's a big ask, and particularly if you have 2 or 3 children, they're sequentially getting unwell, and I think that can be difficult, and we just have to work with parents on that.
Question for Dr. Brady, not to leave you out. Can you expand slightly on the hospital arrangements? We know that you are able to step up the amount that you can take in hospital at short notice, but you mentioned a number of people from care homes in that setting at the moment. Is there scope for people from care homes to move to the hospital, unlike, from lessons we've learned from the pandemic so far?
Last winter we did take people from a care home in, and we were in a position to do that. We'd struggle to replicate that today. I mean, we'd do our very best to look at that sort of thing. But what we have at the moment is we've got a limited number of medical beds today. We've got beds available, ironically, on the orthopaedic ward today, but that's unusual for us. And we have plans that we can expand the hospital further if we need to in terms of medical admissions, and that means opening beds on wards. We're seeking agency staff to allow us to open all the beds on the medical wards over the winter. So that will provide some more capacity. And then we're into contingency planning, which we've become rather good at actually during the COVID period. So if we need to, we can use the day ward differently. We can outflow the intensive care into the COVID units or into the theatre recovery area. So we can do all those things. There's plenty we can do. Staff are working hard. Staff are doing all the right things. We're really grateful to them, but there's more we can do if we have to. We would struggle, though, I think, to take a care home in just now. I really would not be pleased to hear that news.
And any hospital admissions in those under 20 at the moment?
Not at the moment, no. Of the ones who are in with COVID, as opposed to the 4 that I mentioned, 3 of them are over 70 and the other is over 60. So yeah, we're not seeing a lot of young people in the hospital with COVID. We did have I need to be very careful what I say in case people are identifiable, but we're seeing sometimes middle-aged people with unvaccinated. That's happened to us recently.
So, sorry, I didn't say it before. Rebecca Brady from Island FM. In terms of the lateral flow community testing, since those became available for everyone to pick up, there has been sort of, not a shortage, but people were asked not to stock up on them if they already had supplies at home. Could I ask how many people in total have been sort of identified as COVID cases from those lateral flow tests at home?
If we look at our daily run, I would say 60 to 70% of them are lateral flow positive. So numerous on a daily basis. So the lateral flow testing program is working exceptionally well. So basically, if you're a contact of a case, you'll go on to daily lateral flow testing, and we're picking up the cases early because they become lateral flow positive. It also is really effective in minimising your period of contact tracing, because if you're lateral flow negative, we know that your chance of transmitting the virus is extremely low. So if you're negative one day and positive the second day, what's happening is people are taking their lateral flow test in the morning, they're asymptomatic, they were negative yesterday, so we have no contacts other than their household. So it's helping hugely with the contact tracing process, and it's also helping detect tests. I mean, the team are probably going to tell me when I get back it's more than 60%. It's probably close on 70% that are lateral flow positive. So much so is that we take the GESIC call log 5 times a day, and we start the contact tracing process on the basis of lateral flow positives. Now, we know also that we've looked at the conversion of lateral flow positivity into PCR positivity, and we know that 90.8%, when we last audited, of our lateral flows convert into PCR positives. So overwhelming majority will convert. So it's hugely helpful in managing in real time the whole contact tracing process.
It's one area where we've seen science really help
Yeah,
us over the
really
time.
help us,
I
yeah.
know originally we were very sceptical about how effective lateral flow tests. I think the early ones weren't, but now
they've
it's
developed,
really
yeah.
part of our armoury. That's
Yes.
it's really been fantastic. So we're grateful to have them. Yes, ma'am.
Before the lateral flow tests, at the time of everyone being allowed to go and pick some up, we're sort of running short on supplies. Is that sort of fixed now? Are people still able to pick up whenever they like?
Yes, so we've received another supply of lateral flow testing, a large supply that we've received. What we're asking people is please don't go and pick up 5 boxes because we want to make sure that we've got enough to get us over the whole winter period. So we're asking people to just pick up what they need. And again, I truly believe that most people have just picked up what they need. So I do think people are working with us on this. So I think that's been incredibly helpful.
I've got a specific question about QR codes. We had a couple of people contacting us regarding QR codes, especially when they're trying to attain 2 QR codes for vaccines. At the moment, it seems you can't get a single QR code for a single vaccination in Guernsey. Is this an issue, and is this something that could be rectified? People who are, for example, getting a single one in the UK and in Guernsey, and they need proof of 2.
I don't know specifically. We can find out more for you on that, Matthew. I suppose there's always been an issue with people who've ended up having one vaccine in one jurisdiction and one in another. The team do help and sort those people out. Some have been harder to do than others because of for various reasons. But I think if they contact public health, is that the people do?
Contact the non-clinical helpline.
Non-clinical
helpline. People contact the non-clinical helpline, and then they can put the person in contact with the appropriate person. Sometimes what's happened, just from cases I've heard, is people don't have evidence of their first vaccination. Yeah. And so actually getting evidence to legally produce a certificate may be an issue, but I don't know the specific details, so I would suggest they contact the non-clinical helpline.
Now we're all wearing masks again. Have you got any advice about which ones are better, whether disposable are better than material, and what sort of practice we should have in replacing them or washing them and anything like that?
Okay, so So you generally you'd want to replace the mask about every 4 hours or when it becomes wet. The triple layer masks are better because it's a better filter for the breathing out of any infectious particles, provides you with a better protection. For washing, a cloth mask is, I, for example, wear a medical mask when I'm seeing patients in my clinical practice, but when I'm in my office in public health, we tend to wear material masks. Wash them at a washing machine or in hot water with a detergent. So the detergent is what is critical here, and then dry them either outside or in a tumble dryer. So that heat is important. So the mask hygiene and mask etiquette is really important. So having a filthy, dirty mask that you put in and out your pocket for 4 days is not going to be great. Changing. So I'll keep about 4 of these in my office, and I'll cycle those through during the course of the day. Does that answer your question? Yeah.
Question for you, Dr. Salisbury. The CDC, the Centers for Disease Control and Prevention in the US, has actually moved Guernsey to level 4, which is the highest level of risk, warning people against travelling to Guernsey. Are you able to provide a response to that? And also, I have a follow-up question about how this might affect tourism and also the economy, because obviously opening our borders was supposed to protect the hospitality sector, was supposed to enable travel to Guernsey. Obviously not as many people travelling at this time of year.
Yeah, as you say, there's not many people travelling from the US to Guernsey at this time of year. I think, well, it's basically a crude statistic they've used. I think it's, was it 500 and 100,000 is just, so they've just gone like that. They take no account of vaccination rates. I mean, comparing our vaccination rates with the US, that you can't compare them. We're in such a better place than the US, so you can look at things from that point of view. They're doing what they do. I mean, we're in the same category as Jersey, Isle of Man, UK, most of Europe. So it is a threshold that they have used, and people have to make their own decisions based on that. I do know that I think there was stuff coming from the world of cruising saying how they're looking forward to coming to Guernsey next season. I think we've got about 85 cruise ships coming over from April, so we're looking forward to that. So it doesn't look like that'll be a problem. Of course, this is over winter as well. We'll see how things change, particularly in what's happening in the US as well, for that matter. So I don't know if either Peter or Nicky have anything else to add.
I think it is what it is. They've correctly rated it using their criteria, and we obviously respect their right to rate it.
Because we used to do all that, but we've moved on from that now, because we've got a well-vaccinated community, and that's what we're thinking about. And certainly welcome people over.
I know we're obviously in November at the moment, but do you feel quite confident by springtime next year we'll be in a good position where numbers will be much lower again, and we can have a normal, if we can call it that, summer season?
Well, it's looking good. I mean, it is. I'd say the getting everybody, as many people vaccinated as possible, has been fantastic. And really what we're asking for have that great summer next year, have that great tourism season, wear your masks when you can, get your lateral flow tests when you can. And I think, yeah, that it's looking really positive. And so compared with where we've been over the last 20 months, it should do it, all things going well. But it's going to need the community effort to make that happen, as it always has been. And if we've done it before, we can still do it now over the next coming months.
Sorry, last question, just on travel. But we've seen in other jurisdictions, in Europe especially, they're sort of banning unvaccinated people. They're giving them curfews at night, that kind of thing. Could there be anything similar in Guernsey for maybe unvaccinated people next year? We know that this year, obviously, between the UK, unvaccinated or not, you can come in and do up to test. But could we see for jurisdictions outside of Europe, for example?
Well, there's jurisdictions like Austria have been doing it, but I think that's on the basis that the vaccination levels are so low, whereas ours are so great. So why would we need to do that? I mean, yes, we encourage people to have their vaccine. Some people can't have their vaccine. We mustn't forget that. But I would certainly hope not that we would ever be going down that path. We don't need to when we've got such a brilliant community that has taken up the mantle and said, yeah, we're going to be vaccinated. Juliet.
I know quite a few people breathed a sigh of relief yesterday when it was confirmed there wasn't going to be a mandatory mask-wearing mandate. However, we've also got to recognise, as you pointed out today, that our numbers are still going up quite sharply. Even as we're having recoveries, we're having many more people being diagnosed. Do you expect that we might need a mask mandate this winter? And what sort of considerations do you think there will need to be for that to come into place? I mean, how bad do you think things need to become?
I talked to Dr. Brink about whether there are any particular thresholds, but for us, as we're saying, we're talking about the hospital. I mean, for every news conference I've been to, I mean, it's always been quiet for anybody coming in, and Dr. Raby in particular saying, well, actually, it's quite quiet at the hospital. And that's always been a core consideration for us, and it's still quiet. We don't know how things are going to go over the winter. We don't know specifically how many people might get very ill, and that's why we're saying, please wear a mask now to keep it stable. But yes, they're still going to go up. It's just about managing, making sure that the hospital isn't overrun, and we don't see the impact on critical services of people having to come out. So it's very difficult to say, would it be mandatory on that basis? We can't say definitively, but I would certainly hope not. But given as a population, we had a call to arms, say, please wear your mask. And wow, it's been absolutely fantastic. And I think it's about us, as we always try to be, is open and honest with the community about where we are. And we say, that's why we're saying now, really please wear that mask. It's strongly recommended because we want to keep the spread down. Yes, it's still going up, but it's going to be better and it's going to be slower going up if people can keep the mask, have the lateral flow test, make sure that we're picking up cases and we can restrict that spread as much as possible. Dr. Brink, do you want to add any more?
Yeah. So it's just we have our trigger factors, and we will look at, and one of our main concerns is our hospital capacity, and Dr. Raby and I talk on a regular basis. I'll probably phone him more often than he wants to hear from me, but if Dr. Raby expresses concerns about the hospital, of course we will relook at things, but I think at the moment you are quite happy with events.
Yes, we have the trigger factors all set out, and we review them regularly. I just need to say the hospital isn't quiet. The hospital's quiet from a COVID point of view, but everyone there is very, very busy. I don't want to go back and get lynched.
No, it's quiet. The quietness is in the impact of COVID.
Exactly.
But then we're also thinking over the winter months the impact of flu, respiratory diseases, etc. So it's a whole mix, and that's kind of where we are. It's trying to say we're not just, the focus isn't purely on COVID anymore. It's about the impacts on the community, and as it's always been, and there's a trigger point. When we started off March last year, and we were seeing so many people being wheeled into hospitals in Italy and saying, my goodness, nobody's vaccinated. If we get that here, the hospital will be overrun. What do? We're not in that same position here now, but we've still got a hospital that is always busy. And if we do get a number of cases all of a sudden, which we can't deal with, that is when it becomes critical and it can impact other people. So that's why we're still thinking about it, and why we'll still say, we can't ever say won't be mandatory, but I really hope that we won't need to do that, because I think the community will always stand up and say, yeah, we do what you're asking us to do now.
Just a follow-up question. When it came to considering about the mask mandate, how did the economic impacts of people wearing masks come into it? Because obviously I'm sure a mask mandate would have a big impact on the hospitality industry and the social side of things. Was that one of your considerations?
Well, it's funny you say that, because we did make them mandatory earlier in the year, and we gave guidance, say, well, no, we know that if you have a meal or something, you're going to have to take it off. But you actually raise the issue about how difficult it is making it mandatory, because you could say, with every mandate, you have to say, but there are exceptions. And so then it's difficult saying, well, if you want to go to a pub, because we don't want to shut pubs down, we don't want to shut anything down. So, well, yeah, but you can wear it in the pub. But and then it makes it difficult. It's about saying, no, highly recommended, strongly recommended when you can. And that's what we're trying to get that balance right, as I said earlier at the very beginning.
And it's part of that wheel of mitigation. So it's that do-it-all approach, yeah?
Matthew?
It sounds like you've answered this today, but in last week's open letter, it was said that the CCA and Public Health were worried or concerned with rising cases. Are you still concerned or worried, or is it under control now?
So the case numbers are going up. The concern about the rising case numbers is the impact on the hospital. So that fundamentally is the core and one of our most important trigger factors. So we wanted to monitor the rise in cases, but also then look at the community compliance, because initially the community compliance or people engaging it was less good. What we have seen over the last week is a fundamental change, and a lot of people are now wearing masks. So we asked people to come on this journey to wear masks, and again our communities responded. So when the community responds so magnificently, they're coming with us on this journey. So, and I think that's of fundamental importance.
And at this time as well, because I do understand how this has been going a long time. People just want to see the back of it. We all would like to see the back of it, but it's like holding on there. It's so different from where we were, though, last year.
It would be crazy not to be concerned, wouldn't it? Because we've not been in this position, and so we're monitoring it ever so closely, because we have to keep a very close eye on how it's affecting healthcare system and other systems. So I think the answer is yes. We're concerned enough to keep a really tight eye on how it's affecting us day by day, and we are.
Yeah, Peter, you're absolutely right, because we've not been here before, as in all this. I mean, it was just we had the second lockdown, we learned a lot from the first one, but we haven't been in this position before, so it is a learning experience, and we're using our best efforts from the evidence we have to say this is what we think we should be doing at this moment in time. Yeah.
Question for you, Deputy Salisbury. I know today's briefing is for the wider bailiwick and everyone. However, we understand that a number of politicians, including a member of the CCA, following a trip to Jersey's Parliament, have actually contracted COVID-19. Firstly, is this true? And also, is it true that they didn't wear masks during their part of their visit, where they were photographed inside Jersey State's chamber? And if so, what would your message be to colleagues in the CCA and also in government?
I do know, I mean, some deputies have openly stated that they have COVID. I don't know all the ones who might have got it or whether they've all got lateral flow tests. I think it's entirely their position. They have to say where they are or not, so I can't comment on each individual deputy. I don't know whether they wore masks there or not, and I don't know who else other than the Jersey representatives might have had COVID as well, so I can't really comment on it. I think it'd be inappropriate for me to talk about individual deputies and the situation they're in. I think, as I say, I only know one deputy particularly who has actually openly stated that they are positive.
Also picking up on the news from the start that Deputy Fairbrash now has COVID-19. You know, last week he'd written an open letter, and this is perhaps a question to him, but he wrote an open letter to the bailiwick saying, please could you wear a mask? Yet he was pictured at the Centre staff in London not wearing a mask. I know everyone around him wasn't wearing a mask either. However, he now has COVID and he was giving us this advice.
I mean, I think that is a question for Deputy Fairbrash. He is a patient after all now. He has a positive test. And I don't know what instructions were given for the ceremony at the cenotaph either. So, on that, you have had me for this session and not Deputy Fairbrash. I'm sure everybody hopes he has a speedy recovery and wish him well, and I'm sure he'll be back for the next briefing. So thank you very much, everyone.